Hospital. Now, Mirror now continues to highlight India's crumbling health infrastructure, and therefore we bring you these stories from the major metros. After Delhi and Mumbai, it is now seen that the government hospitals in Hyderabad are not maintaining even basic hygiene. Take the instance of Gandhi Hospital, where video footage will show you the kind of filth and squalor that prevails in the premises of this hospital. This video came to light after the brother of a journalist who died in this hospital exposed the poor conditions inside the hospital, whether it is the dumping of PPE kits all over the place. What we saw, in fact, visuals on your screen will display how PPE suits are carelessly dumped at the hospital premises. A patient who was also a journalist, like I said, died at this hospital, presumably or allegedly because of delay in treatment. Also, a relative of another patient has revealed a video of the poor facilities in this same specific hospital, the Gandhi Hospital in Hyderabad. At least 3 instances of lapses coming to the fore from the same hospital. In the first, a journalist who had tested positive for COVID died of a cardiac arrest. He wanted to be shifted out to a private hospital, but before that, he succumbed to COVID-19. His family claims that at the Gandhi Hospital, the treatment was inordinately delayed. The brother of the deceased, who is also COVID positive, claims that he had to fight with the doctors to shift him to the ICU in the first place, despite his critical condition. And even in the ICU, the brother of the victim claims that he did not receive the kind of treatment that he should have been given under the circumstances. Even there was delay in providing oxygen cylinders. On the morning of 7th of June, Manoj, the journalist, passed away. He was in the ICU from 4th to the 7th of June.
He has informed me that kindly inform this hospital staff that I am feeling, I can't breathe. So I went there. I just looked out of the ward. No one, I didn't find anyone. मुझे वहाँ कोई भी नहीं दिख रहे थे. मैं डॉक्टर से मैं फाइट कर रहा था वहाँ पे कुछ कीजिए, कम से कम आईसीयू को अगर आप नहीं ले जा रहे तो कम से कम यहाँ पे कुछ ऑक्सीजन सिलेंडर का कुछ व्यवस्था करिए. उन लोग बोल रहे थे कि ऑक्सीजन वी डोंट हैव एनी ऑक्सीजन सिलेंडर्स, वी डोंट हैव ऑक्सीजन सिलेंडर्स अवेलेबल. Then मैंने पूछा why don't you shift my younger brother to ICU? Then they were saying that there were no empty bed. सुपरिटेंडेंट तक वो प्रेशर बहुत आ गया था. सब सुपरिटेंडेंट आके बात करके गया, we will attend you and we will give special care.
Now, this is a detailed case study that we are going to bring you, because my colleague, in fact, had a conversation with the patient before his passing away. We're getting you all the details on that. What really happened was, before his death on the 7th of June, journalist Manoj spoke to his brother as well as to Times Network correspondent, highlighting the apathy of this hospital. Sharing his ordeal with Times Network, he said that he wanted to be shifted to a private hospital as the facilities in the Gandhi Hospital were deplorable. In the chat, he also said that there was a higher risk for others to be infected by the virus because very basic hygiene and the measures that should be followed in a COVID facility were sorely missing. He asked if a separate room was possible, since there was a sharing of a bathroom even for COVID patients, which can prove to be hazardous for the others. All his appeals fell on deaf ears. So this is what we have in terms of how this patient dealt with his treatment in this hospital. And now we are going to also tell you the kind of conversations that he had both with his brother and with Times Network correspondent. Manoj had spoken to his brother just few days before he passed away. He had shared with his brother that there was barely any hospital staff attending to him. He wasn't even given an oxygen cylinder when he was needed, and he was desperate to be shifted out. Let me go across to Shamit, my colleague, who in fact spoke to Manoj just ahead of his passing away. So Shamit, you in a way have a first-hand account of how this case was dealt with in Gandhi Hospital. Can you tell us what exactly happened with Manoj from the time that he came to this hospital to his ordeal in the ICU, and what finally led to his death?
Yes, I want to also make it clear what happened in the beginning. On 3rd he has tested positive, and on the midnight of that third and intervening night of fourth, he received a call from the concerned doctors of Fever Hospital, that is state-run hospital, stating that he should come to the hospital because he tested positive for COVID. Thereafter, after reaching to the hospital, due to some paperwork, hours were wasted in the Fever Hospital. That is around 2 to 3 hours were wasted in the Fever Hospital. Later, he was shifted from there to the Gandhi, and he got admitted at around 12:30, 12:40 a.m. On 4th. And later, since then, there was no one to attend him from that time. And around at 11 or 12, a doctor came after we intervened. His brother was calling all of us and saying that no one was attending him, no doctor, no medical staff is attending him. So we made calls to the superintendent, the health ministry, and requested that treatment should be provided. Then superintendent attended Manoj Kumar at around 12:30, and what he have done is nothing. Nothing. But later, it was around 4:30.
Right.
Then he was actually requesting for the oxygen because he has developed heavy breathlessness, and he couldn't breathe. He was continuously requesting for the oxygen, which is minimum basic request by the patient, which is made. He was not making any request which is not possible. That was the basic request. Oxygen should be provided to a patient who is really developed and having heavy symptoms. He was having pneumonia, bilateral pneumonia, and also he was suffering with COVID. So at that time, no oxygen was provided. He then at around 4:30, when minister responded to us stating that special care will be taken care of Manoj. Then around 4:30, he was shifted from the general ward to the ICU. At that time also, they have informed that there are no beds available in the ICU. They have made Manoj Kumar to sit on a wheelchair for around 1 to 1.5 hour, over 1.5 hour in the ICU in the Gandhi Hospital on 7th floor. And then later he was provided a bed in the ICU, and oxygen support was given to him. How shocking it is! A patient having heavy breathlessness and heavy symptoms, suffering with pneumonia and also the COVID, is waiting for the oxygen in the state-run hospital, which is a nodal center in the state. All the COVID patients are treated in this Gandhi Hospital. We should also notice that he was completely unhappy, and he was sending messages to me. He was sending messages to his brother and other colleagues stating that he was very desperate to be shifted to the private hospital from the Gandhi, because no basic facility was provided to him. No oxygen was provided to him. One bathroom is used by around 20 patients. That is shocking, really shocking. And he was really unhappy and wanted to be shifted to the private hospital. On the other hand, on 7th, however, he succumbed due to cardiac arrest, and he went to the washroom, and he suddenly collapsed there. And doctors tried to revive him, but till then he was declared dead. If at all the doctors
so
could
basically,
have
Somit, what you're saying is that he received no special attention in the ICU. There were no facilities there to take care of his ailments. We understand that he had comorbidities. Like you said, he was suffering from pneumonia, he had heart ailments. That is the reason why he needed critical care, which was denied to him. So through the conversation he had with you, Somit, we get to know no one attended to him. He was sharing a bathroom, and also he did not get oxygen supply. What is the reason that one would be in ICU if very basic oxygen supply is not there? So those are very big questions. Stay with us. I also want to highlight here the kind of condition that this particular hospital was in, because this is a video footage that has been accessed by Mirror Now through the brother of the deceased. Let's give you the details of how the corridors of this hospital, what they look like. It seemed to be littered with waste. There were PPE kits, PPE being the protective gear, used PPE dumped all over the place. So let's first listen in to the relative of the deceased patient.
गांधी हॉस्पिटल में इतनी गंदगी आपको बता नहीं सकते। उसमें था कि आप देख सकते हैं कि वॉशरूम के बाहर जो लेन रहती है उसमें पूरी गंदगी, पूरे जो पीपीपी किट्स डॉक्टर द्वारा पहने जा रहे हैं ना, वो हमारे उतारे जा रहे हैं, पूरे फेंक दिए, पूरा कूड़ा मचे हुआ है, पूरी गंदगी है। और गांधी हॉस्पिटल जो फर्स्ट फ्लोर पे सस्पेक्ट का वार्ड है, उसमें जहाँ टॉयलेट है ना, वहाँ का यूरिनरी सिस्टम भी खराब हो गया है, शायद पूरा यूरिन बाहर आ रहा है गली में।
So, Somit, coming back to you, what is evident here is that even very basic care and caution that is required in a COVID facility was not there in this government hospital that was attending to COVID patients. Clearly, Manoj may not be the first or the last one. So, is there a general apathy towards patients? I mean, apathy is perhaps really not even the good word here, because this is much more than apathy from what we can see. Are patients being dealt with in this manner in government hospital in Hyderabad?
Exactly. We have shown the clear pictures. What is the scene in the Gandhi Hospital? That is the only hospital in Telangana which is treating the COVID patients. And according to today's figure, there are around 475 patients right now undergoing critical care in the Gandhi Hospital, apart from others. And we can see clearly how negligent the staff is. We can't even blame the doctors there. We can't even blame the medical staff there, because only very few, one doctor is treating 15 patients, 15 critical care patients, and two the medical staff, the cleaning staff, the sanitation staff are looking after the 65 bedded wards, and there are around 6 to 7 wards in the hospital. Apart from the general wards. So this is the situation here, and the CM KCR has given a press release stating that someone is propagating the things and are clearly blaming the Gandhi Hospital, in which everything is well. It is just a cover-up, nothing more than that. It's just a cover-up. And we have seen clear photographs there. Used PPE kits
Yes.
have been thrown everywhere in front of the toilets. The COVID patients who are right now in the wards are using that way, where the used PPE kits are there, using that way to go to the toilets. And how sad it is to see such an unhygienic condition in
Yes.
the government hospital there. And Manoj is not
Right.
only the patient. Manoj is not only
Right,
the
whether it
patient who
is
has suffered
Jalgaon,
there.
where an elderly woman, an elderly woman was found dead in a toilet in Jalgaon Government Hospital, and in Hyderabad in Gandhi Hospital. This is the situation. Pictures speak louder than words. Shamit has exposed the level of deplorable condition that is there. Thanks very much for joining us, Shamit, with this particular case study and for giving us an update of the government hospitals in Hyderabad.